Hey everyone, and welcome back. Today, we're diving into a question that's, well, a little weird, but also incredibly cool. What can our sewers, actually tell us about our health? We're going to explore how wastewater is becoming one of the most powerful new tools out there for public health. Okay, so just imagine this for a second. You get an alert on your phone that flu cases are starting to spike in your city, giving you a valuable heads up. But here's the twist. That alert didn't come from a hospital or a doctor's office. Nope, it came directly from the sewer system running right underneath your feet. It sounds a little like science fiction, but I promise you, it's very real. And this brings us to the huge idea at the center of all of this: wastewater-based epidemiology. The concept is actually pretty simple. When we get sick, things like viruses and bacteria leave our bodies and, end up in the sewer. So by sampling that water, you're basically taking a pooled health sample. It's like one single snapshot that represents an entire community all at once. Now, the real power of this method, it's just so efficient. WBE is one of the absolute fastest ways to get a sense of what's happening across a whole population, and you don't need thousands of people to go get tested individually. But, and you knew there was a but, right? The raw data you get from the sewer is incredibly messy. It's not nearly as simple as just counting viruses in a water sample. So how does it actually work? How do we get from a toilet flush to a public health forecast? Let's follow the journey of a single data point through this four-step process. First, a sample is collected from a treatment plant that covers a specific area. Then it's off to the lab, where scientists concentrate that sample way down and pull out all the genetic material. From there, they use tools like PCR, the same technology we all heard about with COVID tests, to measure how much of a specific virus is present. But here's the crucial part. The final number isn't a case count. It's a signal. It's one point of data on a timeline that should correlate with how much infection is out there in the community. And this is where we hit the biggest challenge in this entire field. The signal we get is definitely powerful, but it's buried in a ton of what scientists call noise. Basically, all these other variables that have absolutely nothing to do with how many people are actually sick. Let's break down the three biggest culprits. First, there's dilution. A huge rainstorm hits, floods the system with extra water, and suddenly it looks like virus levels have dropped off a cliff, when they haven't. Second, you've got lag. People shed viruses at different points in their illness, so the signal in the sewer doesn't perfectly match when people are feeling symptoms. And finally, sampling noise. If the collection schedule changes or they miss a day, you get these weird gaps and jumps in the data. If you just react to these raw numbers, you'll be chasing false alarms all the time. And this is what that raw data can look like. It's a chaotic, jagged mess, right? It goes up, it goes down, and it's almost impossible to tell what's a real trend versus what's just, noise. The real job here isn't just collecting data. It's cleaning this messy signal up to find the truth that's hidden inside. So how in the world do you clean it? This is where machine learning comes into the picture. AI models are exceptionally good at looking at messy, complex data just like this and finding the real patterns underneath that a human eye would probably miss. They can basically see right through the chaos. Machine learning helps in three really practical ways. First, there's nowcasting, which is basically estimating what's happening right now, even if the lab results are a few days delayed. Second, there's forecasting, predicting what the trend will probably look like next week. And third, anomaly detection, which is about spotting a sudden, unusual spike that might be the very first sign of a brand new outbreak. So remember this problem? Our raw, noisy, and frankly, kinda untrustworthy data. It's full of potential, sure, but on its own, it's not really actionable. And this is what the AI does. It takes that chaotic line and finds the smooth, clean trend line hidden inside it. This is the signal, the reliable trend that public health officials can actually use to make decisions. It separates the real story from all that noise. And this quote really just nails it. The goal isn't to build some super complex, fancy AI that nobody understands. The point is to build a model that's stable, reliable, and easy to interpret, something a public health director can look at on a Monday morning and use to actually plan the week ahead. Okay, so we have our clean signal, now what? Because an early warning is only useful if it actually leads to a decision, right? So let's look at how this signal translates into real-world action. The best analogy for this is to think of it like radar. Wastewater data doesn't replace things like clinical testing or case counts. It's a complementary tool. The radar tells you that something is approaching on the horizon, giving you precious time to prepare. You still need your other instruments to confirm what it is and respond in the right way. So what does that response look like? Well, an early warning from the wastewater can trigger very specific actions. It can tell officials to increase targeted clinical testing in certain neighborhoods, or alert hospitals to get ready for potential surge in patients. It can be the trigger to send out public health messages to high-risk groups, or even help decide where to send mobile health clinics. It helps the public health response be proactive instead of just reactive. Of course, with any powerful new technology, there are really important questions to ask and some practical limits to think about. This isn't a magic bullet, so it has to be used thoughtfully and responsibly. There are two big challenges to always keep in mind. First, coverage. Not everyone is connected to a municipal sewer system, especially in more rural areas, which means some communities could get left out of the data. Second is how to handle really specific data. As this tech gets better at sampling down to the neighborhood or even building level, it raises some serious questions about privacy and how that information gets used and communicated. So the way forward is to be very clear about the rules. That means having transparent governance, a process that everyone can see and trust. It also means setting clear, predefined thresholds for when a signal actually triggers some kind of action. And crucially, it means communicating the findings in a way that's clear, helpful, and doesn't single out or stigmatize any one community. As we start to wrap up, it's pretty clear that even with the challenges, wastewater surveillance is turning into one of the most practical and powerful tools we have for getting a jump on public health threats. It gives us a snapshot of community health that was just never possible before. So, is machine learning a magic wand that solves everything? No, of course not. But what it does is absolutely critical. It takes a promising but messy data source and makes the signal usable. It quantifies the uncertainty so we know how confident we can be in a trend, and ultimately, it just makes the alerts we get far more reliable. And that leaves us with one final big thought. If we can detect disease outbreaks from our wastewater, what other hidden signals about our collective health, our habits, and our behavior are flowing right under our feet, just waiting to be decoded? And that's all the time we have for this explainer. If you found this topic interesting, be sure to hit that like and subscribe button for more. And if you'd rather listen, you can find the audio version on your favorite podcast platform. We've got the links in the description. Let us know what you think in the comments, and we'll see you next time. Thanks for watching.